skeleton. The axial skeleton consists of the head and face, the hyoid bone, which sits in this area and is not seen on this model, the sternum, the ribs, and the vertebral column, shown here. The other components of the skeletal system are known as the appendicular skeleton. The upper appendicular skeleton consists of a pectoral girdle made up of an anterior clavicle, posterior scapula, and the bones of the upper appendages. The inferior appendicular skeleton consists of a pelvic girdle made up of the innominate bones, as well as the bones of the lower extremities. This video will focus on the axial skeleton. The appendicular skeleton will be covered in a separate video. This is an anterior view of the skull. The bones of the skull are divided into two categories, the cranial bones and the facial bones. In this anterior view of the skull, we can see the frontal bone. If we rotate the skull laterally, we can see the right parietal bone. This is the right temporal bone. If we rotate the skull so that we have a posterior view and an inferior view, we see the occipital bone. The other two cranial bones, the sphenoid and ethmoid bones, are seen from within the cranial vault. This is the sphenoid bone, and for reference I've placed a disarticulated sphenoid bone on the side. This is the ethmoid bone, specifically this is the crista galli of the ethmoid bone, and again for reference I've placed a disarticulated ethmoid bone to the side. We'll be going through all of these bones, and I'll be showing you the surface features that are important on these bones. Whenever possible, I will show you the surface features on the articulated skull as well as the disarticulated bones. We're looking again at an anterior view of the skull. Going to glance quickly at the facial bones. Going to increase the magnification a little bit. These are the nasal bones. You have right and left nasal bones forming the bridge of the nose. These are the lacrimal bones. Looking in the nasal cavity, looking at the nasal septum in particular, this is the vomer bone, which forms the inferior aspect of the nasal septum. Within the lateral walls of the nasal cavity are the inferior nasal concha, here and here. Now we're looking at a left lateral view of the skull, focusing on the left zygomatic bone, commonly known as the cheekbone. Two of the other facial bones are the right and left maxilla. So you have two bones forming the upper jaw. In contrast, the mandible or lower jaw, let's push that back just a bit. The mandible or lower jaw is formed from a single bone. Wrapping up the facial bones are the palatine bones, here and here. The palatine bones articulate with the palatine processes of the maxilla, which are here and here, to form the hard palate of the roof of the mouth. We're looking again at the anterior aspect of the skull, and I wanted to show you this again just so that we're all oriented. I'm going to rotate the skull. I want to talk a little bit about the formation of the bones of the skull. You can see here two of the prominent sutures of the skull. This is the frontal or coronal suture, which connects the anterior frontal bone to the posterior parietal bones, and it's just like the frontal or coronal section. Rotating just a little more, this is the sagittal suture, articulating the two parietal bones, and this is just like a sagittal section or plane through the body. Now we're looking at the right lateral aspect of the skull. This is the squamosal or temporal suture, which joins the temporal bone to the parietal bone and anteriorly to the greater wing of the sphenoid bone. This last suture, again, I'm starting with an anterior view of the skull just to make sure that we're all oriented. So as you can see, I'm rotating things. Lateral, posterior. I'm going to try to stand it up a little bit. And the suture that you see right here is the occipital or lambdoidal suture, which connects the occipital bone to the parietal bones. As I said, I wanted to talk just a little bit about development of the bones of the skull. The bones of the skull develop via a mechanism called intramembranous ossification. Again, we're looking at a fetal skull. The areas such as this are actually membrane at this point. Now this is called the anterior fontanelle. Imagine this skull as a membrane and ossification centers developing here and here. Rotating laterally now to see the right parietal bone, ossification center here, and etc. In other words, everywhere where there's going to be a bone, we get an ossification center in these membranes. The area of ossification spreads, but while the ossification is occurring in the membrane, there are still areas of membrane between the bone. These areas of membrane are called fontanelles. This is the anterior fontanelle, or commonly called the soft spot. Watch as I rotate. This is the posterior fontanelle. And if we look laterally, this is the anterior lateral fontanelle, the posterior lateral fontanelle on the right side, and you have the same thing on the left side. So notice that the frontal or coronal suture extends from the right anterior lateral fontanelle up through the anterior fontanelle, down the other side to the left anterior lateral fontanelle. We're going to go through the bones now of the cranium and the face and the important surface features of each bone, starting again with an anterior view of the skull so that we're oriented. Our first bone is the frontal bone. I'm going to zoom in to see the supraorbital notches. Here and here. The supraorbital notches are the passageways for the supraorbital nerves and vessels. Our next surface feature on the frontal bone are the supraorbital ridges here and here. This is where your eyebrows are. The coronal suture is a surface feature associated with the frontal bone. We saw the frontal or coronal suture earlier, but here it is again. The final surface feature associated with the frontal bone is the frontal sinus. I'm going to change to a different skull to show that. I'm going to change to a sagittal skull. Before I go to the sagittal skull, let me simply point out that the frontal sinus is in this area. Okay, starting with an anterior view to get our bearings, you can see the orbital fossa here. This is a sagittal section of the skull. And the frontal sinus is this space right here. Our next bones are the parietal bones. They are paired bones of the cranium. The only surface feature associated with the parietal bones that you're responsible for is the sagittal suture, right here between the two parietal bones. Our next bone is the temporal bone, which is right here. And you have numerous surface features associated with the temporal bone. This is the mastoid process, which is a muscle attachment. This is the squamous portion of the temporal bone, simply the flat part of the bone. This is the zygomatic process of the temporal bone. There's a suture right here where this zygomatic process of the temporal bone articulates with the temporal process of the zygomatic bone. So when the temporal process of the zygomatic bone and the zygomatic process of the temporal bone articulate, they form the zygomatic arch. The external auditory meatus is this opening right here. The mandibular fossa is the area right here. It's the part of the temporal bone that forms the temporomandibular joint, or the TMJ. The mandibular condyle of the mandible, which is this structure, articulates with the mandibular fossa of the temporal bone to form the temporomandibular joint. Going to have to turn the skull around a little bit to see the next surface feature. I've threaded the green pipe cleaner through the jugular foramen. The jugular foramen is the passageway for the internal jugular vein. Now, in addition to the green pipe cleaner running through the jugular foramen, there's also a pink pipe cleaner running through the carotid canal. The carotid canal is the passageway for the internal carotid artery. Watch carefully as I remove the pipe cleaners, and you should be able to actually see the openings. So that's the carotid canal. Here comes the green one out of the jugular foramen.